It is currently a very challenging time in India. Many of them are infected with COVID, many of them are worried they will get COVID, and many are worried about vaccines. So today we want to answer some of the common questions about vaccines that have been raised by many. I want to introduce my panelists, Dr. Aruna Subramanian, who is a clinical professor in infectious disease at Stanford University, and Dr. Philip Grant, who is an assistant professor in infectious diseases at Stanford University. Both Dr. Subramanian and Dr. Grant have a lot of experience in taking care of patients with COVID and have also worked a lot on vaccines in COVID-19. Welcome, Dr. Subramanian and Dr. Grant. So Dr. Subramanian, let me start off by asking you, what is a vaccine? Right now, so many people in India already have COVID. Do you really think we all still need to ask them to take vaccines? Or will India already reach a herd immunity by so many people getting infected with COVID?
Vaccines are this wonderful thing that allow us to develop protection against an infection without having to go through the difficulty of the infection itself. Normally, when you get infected with a virus, then your body produces things called antibodies that help you fight off the virus, but it takes several days to a few weeks to actually get those antibodies. So in the meantime, people get very sick and they have to experience all the downsides of having the infection. Whereas if you get the vaccine, which doesn't actually have the virus, it may have pieces of the virus or other things that allow your body to produce antibodies, you get the protection without having to go through the downsides of having the infection. So I think it's so important. That's how many countries are getting through this pandemic. That's how we're all getting to normalcy, by getting large numbers of people, by getting the majority of the population vaccinated. It's so important for India to take these vaccines to really get through this pandemic.
Thank you, Dr. Subramanian. Dr. Grant, let me ask you this, that in India, currently we have the Covishield vaccine and Covaxin. Sputnik V is going to be coming soon. And here we've had experience with Pfizer and Moderna. Which is the best vaccine? Which is the vaccine that you would recommend to your family to take?
I give the analogy of if you're in a real hurry to get somewhere, which kind of car would you want to drive? Would you like a Mercedes, a Jeep, lots of different choices, but they all get you there and they all get you there safely and way better than walking, which is kind of what I would say would be the way to get infected, would be kind of walking. There's a lot of things that could happen to you while you're walking on a long journey. A car, there's lots of different versions of different cars, but ultimately they're pretty much the same. They get you there, they get you immunity. So I think there's different types of ways to get immune, slightly differences with the viruses, with the vaccines. But I think ultimately, I would recommend whatever car is right near you to buy. So hopefully you can get a vaccine, whether it be Covishield, whether it be Johnson & Johnson or whatever it happens to be available. That's the one I would recommend.
So if you had the choice of all the vaccines available to you and you had your family member in front of you, which vaccine are you going to give? Because I would want Mercedes for my family.
Really, if I was an Indian, I probably would go with Covaxin because it was developed in India. And I think it's the first one that was developed. But, if at the same car dealership, all the cars were available, maybe that would be the one I would take because I think that's quite an accomplishment. But if, I went to the car dealership and a different one was available, that's certainly the one I would drive off the lot.
Thank you, Dr. Grant. So Dr. Grant, let me also ask you this, that do we have enough studies about these vaccines at this time, or are we recommending something based on just a few studies just because we want everyone to be vaccinated? Specifically, do you know if these vaccines, especially Covaxin and Covishield, are effective against the variants, the double and the triple mutants that we keep hearing about?
Yeah, I think that is a good question. It's important to keep things simple. In terms of studies, now hundreds of millions of people have been vaccinated safely. So there's not a lot of things in medicine that we have more experience with. The other thing is these vaccines, while thought to be new, they're using technology we've used for a lot of different types of infections that also been shown to be safe. So I think we do have excellent safety data. in terms of the vaccines. In terms of the variants, the other thing that people think about, the variants aren't a totally different virus. They're just slight differences. And all the data so far show that the vaccines protect against severe disease with all the different variants. There may be some slight differences in terms of mild disease. I think what we're mainly trying to keep is people out of the hospital. And all these vaccines are doing a great job of that.
Thank you, Dr. Grant. So, Dr. Subramanian, we all received the mRNA vaccine here, the Pfizer and the Moderna. What are the experiences of people with the first and second dose of Covishield and Covaxin? Are they getting sick from that vaccine?
Yes, we received the mRNA vaccines here, but millions of people around the world have received the AstraZeneca Covishield vaccine, and Covaxin is very similar to other vaccines. It's inactivated, killed virus. So, we, as Dr. Grant said, we have lots of experience with these types of vaccines. And the vaccine, when you get it, yes, your immune system is being revved up in order to make those protective antibodies against the virus. So you develop some symptoms that really are going with your own immune system being activated. But it's not that people are getting sick from the vaccines, they're not getting infection from the vaccine. And these stories of people getting COVID right after getting the vaccine are really probably that, they were exposed at some time around that time. It's not, you cannot get COVID-19 from the vaccines itself. So yes, you may get mild fevers, chills, headache, arm pain from the vaccine, and you can take Tylenol, that's paracetamol, Dolo, even Brufen, other NSAIDs if needed, but really you cannot get COVID from the vaccine. When you go to take the vaccine, you should be wearing masks, you should be taking care, you should be social distancing from other people the way you would if you were going out otherwise.
So, Dr. Subramanian, do you think that we have enough studies on these vaccines as we would for any of the other vaccines, non-COVID vaccines that we've had before?
Yeah, in fact, many vaccine developers feel that we have so much data on this, there's no concerns in terms of giving it to large numbers of people, since we've given it to many, many people and we're finding excellent safety data from these vaccines.
So, Dr. Grant, some people are worried that they will get a blood clot, especially with Covishield. Is that possible, and how common it is?
With almost any medicine, there are rare side effects. And so ultimately, with any medicine, and a vaccine is a medicine, you want to make sure the benefits are much stronger than the risks. So penicillin can give you a rash or sometimes a severe allergy. And vaccines also may have a rare side effect. And the blood clots that people are concerned about are very rare. In the United States, just a handful of people have gotten blood clots, mainly from the Janssen vaccine. In Europe, also just a number have gotten from the AstraZeneca vaccine. So it is a rare risk. The numbers have been 1 out of 100,000 approximately. The people that get blood clots are the same people who are at risk in the general population. So generally younger women have been at risk between 18 and 50. But the truth is it really only, it's about a 1 in 100,000 risk, which is really kind of what would happen even if you hadn't received the vaccine. So during those 2 weeks after the vaccine, you do have an increased risk, and then it goes away.
Thank you, Dr. Grant. So let me push this point a little bit more. Of course, everyone is worried about getting a blood clot. It can be a very scary event. So is there something that you would recommend that the people should follow up on? Is there a test, or what should they do so they know that they can catch the blood clot easily?
Given how rare the event is, I don't think I would be too concerned. It's kind of almost like, how do you prevent lightning from striking you? It's hard, but it's not something you should worry about when there's a lot of other risks, like actually getting coronavirus out there. So I think it's important to kind of balance the risks and the benefits. That being said, if one had a very severe headache that didn't go away, really severe abdominal pain in the stomach. Those would be two things that would have me go to the doctor. But even if you did have those symptoms, it's not very likely to be a blood clot, but it'd be something to get checked out for.
Thank you, Dr. Grant. So, Dr. Subramanian, would you ask people to get D-dimers after they get the vaccine?
I would say no. There's no reason to do that. If you were, the point I was going to make is that if you were to develop COVID, you're at much higher risk for developing blood clots. So really, as Dr. Grant said, the risk benefit there is tremendously, the benefit is greater for vaccine. And this is so rare. Even saying 1 in 100,000 is being very conservative. Some estimates are even up to 1 in 10 lakhs. So this is so rare that we should really be following people with their symptoms. And it's not something subtle. If in those people who develop clots, they have symptoms that really make them go to the doctor. It's not something that can happen silently and people wouldn't know. And so I think that there's no reason to check D-dimers or any other blood tests, because you're not going to find people who actually have this side effect. It's so rare.
Thank you, Dr. Subramanian. So what I'm hearing so far is that in general, the vaccines have been safe enough. We have enough studies to say that these vaccines are effective, especially from preventing severe disease and death in patients. It is important that we take these vaccines, otherwise we will not be able to feel safe as a community. We will not reach herd immunity without these vaccines. And the chance of having a side effect just from the vaccine is so low that it is really worth it taking the vaccine, as we all did here. So let me ask you that there have been multiple reports, Dr. Subramanian, about sudden deaths right after the second dose of Covaxin or Covishield. That is a very scary event. You go with all of this trust to get the second dose of the vaccine and you're ready to feel protected from COVID. And then suddenly, after 1 or 2 days, some deaths were reported. What are your thoughts, and what should people prepare themselves for when they're going to get these vaccines?
I think we have to be careful really trying to understand causality of these things, right? Because, you could get the vaccine and unfortunately go home and get killed in an accident, right? I mean, it's not, and there clearly we know it's not from the vaccine that it happened. So, all the studies that have been done have not linked any sort of causality with death. We see, that's almost unheard of. So it seems that the media does concentrate on these things, but it's really not something we're seeing after vaccines, and we don't think that they're related to the vaccines at all. I would recommend it for my family. I recommend it for, my own parents and my in-laws. So it's not that I'm saying something different for my neighbor versus my own family. I feel very, very safe with these vaccines. And I don't think people should worry that they're going to have any of these bad events happen from a vaccine.
Thank you, Dr. Subramanian. And I'm with you. My entire family is vaccinated. I'm just waiting for the vaccine for my kid at this point. So, Dr. Grant, let me ask you this, that should people try to get their antibody level checked before deciding to get the COVID vaccine, and why or why not?
We've shown the antibodies actually, they wane in some people who've had the infection before. And even if you were infected, that the immunity is not going to last as long as actually getting the vaccine. So there's no good reason to check your antibody before you get the vaccine. The good idea is the vaccines all produce really good antibody levels after you get it. So there's no reason to check either before or after the vaccine to your antibody levels.
Thank you, Dr. Grant. So, Dr. Subramanian, I'm going to switch a little bit to pregnant and lactating women. Should they take the COVID vaccine or should they not? Were they actually included in the studies for Covishield and Covaxin? So that makes us comfortable enough to give this recommendation.
Yeah, That's a very individual decision. Here, we did include many people in the mRNA vaccines and gathered data. As time went on, we've had thousands of people who got Moderna and Pfizer, and we feel very comfortable giving it here. In terms of AstraZeneca, the Covishield vaccine and Covaxin, no, pregnant women were not included in the actual trials, but the technology that, as Dr. Grant had said, has been used in many other vaccines previously, and all of those vaccines are known to be safe in pregnant women. So this is really all about risk versus benefit. In my mind, the benefit of vaccinating pregnant women is really high. Pregnant women can get into problems when they have COVID. So they are people who really need protection. And if they're vaccinated, they will give their antibodies to their infants when they're breastfeeding. So there's a lot of advantages to getting good protection for pregnant women. But and now the Indian government is allowing vaccination in pregnant women, but it's really a conversation you should have with your OBGYN and feel comfortable. But I would feel comfortable saying that it's with the information we have so far, it seems to be very safe and protective.
Thank you, Dr. Subramanian. So I'll open this to both of you. That were you involved in caring for any pregnant patients who got COVID, and you were directly involved in providing care to them?
Yes, I think we both were. We both took care of pregnant women in the hospital, even pregnant women who were in the ICU. We watched them carefully. Thankfully, they were treated in the hospital and got better, and their children, their babies did well when they had their deliveries, and the babies did not develop COVID. And we had very good outcomes here at Stanford. So, if you take care, things can go quite well, even for pregnant women.
Thank you for mentioning that, because I know that there has been a concern that if you get COVID during pregnancy, then should you continue with the pregnancy or not? Have you been involved with any of the pregnant women who delivered their babies and got the vaccine during their pregnancy? How did the babies do?
We have data on, I think, tens and thousands of pregnant women now who've had the vaccine and done just fine. The important thing is, the vaccine is something that is just going to produce antibodies in the mother, and that'll just be transferred to the infant when the infant is born. So I think that's hopefully not something that people are too worried about, but the babies have been doing just fine. You never know how your children are going to do when they get older, but I don't think it's the worry of the vaccine causing problems.
Thank you, Dr. Grant. Dr. Grant, let me ask you this, that there has been a lot of confusion about the timing of vaccine. If someone gets COVID, can they get the first dose of vaccine right after? Do they have to wait? Or what should we do?
I don't think there's a really big scientific question around that. I think you should wait till you recover from COVID before you get the vaccine. So if you're very sick, that might take several weeks. If you're just mildly ill, maybe that would be sooner. But I think the guideline, I would say after you've had COVID, after you recover, maybe about 2 or 3 weeks later, if you're feeling fine, I would just go about getting vaccinated.
So I know that there has been a challenge in getting the vaccines right now in India. So if someone gets the vaccine too soon, like 1 week after, or maybe like 6 weeks after, depending on when the vaccine may be available, is there a particular harm or benefit in getting it too soon or too late?
I think either that timing would be fine. There is some protection from having prior COVID, and that should still be there at 6 weeks. I think whenever it's available after, if you've been ill, is the right time to do it.
Awesome. Dr. Subramanian, is there any data at this time to mix different types of vaccines? Because if someone took Covishield as the first dose and now it's no longer available, can they take Covaxin or Sputnik V or wait for Pfizer and Moderna or Janssen? Or should we just stick to the first dose, whatever we got to get the second dose of that?
So the studies were all done with the same vaccine for both doses, but it's a good question when there's such scarcity of vaccine, right? And in mice, there are studies showing that if you mix and match vaccines, you might even get a better response. There are ongoing studies in humans as well, mixing and matching vaccines, and they may work well, but for now we don't have that data. If you absolutely have no other choice, then it might be fine to go ahead. But if you have a choice right now, we're still recommending taking both of the same vaccine if it's possible.
Thank you. So if someone gets COVID after the first dose of vaccine, does that mean the vaccine was not working for them?
Well, you don't get complete protection with just one dose. And the protection that you get really protects you from severe disease. So you might still get mild disease after getting the vaccine, even both doses, but it's usually much less severe. People aren't being hospitalized usually and don't need the ventilator or other things that go with severe disease. So it doesn't mean it didn't work. Sometimes it means you didn't have enough time to develop a good immune response yet. And the protection, as I said, isn't 100%.
Thank you, Dr. Subramanian. It really takes like 2 or 3 weeks after you receive the vaccine to get your full immunity. And you want the second dose, so the first dose itself is just not completely effective.
Right, exactly.
So, Dr. Grant, do you think the vaccines will change our DNA, who we are as a human being, or will we pass some bad things to our children?
Right. None of the vaccines can enter into our DNA. We've been evolved as a species to really protect that DNA. So it's only very unique events that can change the DNA and not vaccines.
Thank you, Dr. Grant. So seems like vaccines are not going to be changing our DNA. They are not going to be giving us COVID, and they can protect us from severe disease or death. So we are almost out of time, but I want us to understand how these vaccines actually work. So if Dr. Subramanian, you can start off by explaining to us, how do the mRNA vaccines work, the Pfizer and Moderna?
Sure. The mRNA vaccines work in that they give you a little bit of the genetic material from the virus. It gets into your cells, and then your own cell makes a protein that is part of the virus. It's the spike protein on the outside of the virus. And then when your body sees that spike protein, it thinks that it needs to make protection against that. And that's what makes the body make antibodies against those proteins.
So no DNA is being transferred. It is just really helping the body make some helpful proteins to protect us from infection.
Right. And the mRNA gets destroyed by your body. It doesn't last long. It's just those spike proteins that are made so that your body can make the antibodies.
Thank you. Dr. Grant, how do the AstraZeneca or the Covishield or Sputnik V vaccines work?
Right. Those are all what we call viral vector vaccine, but it's actually not that different than the mRNA. So the mRNA have fat droplets surrounding them that enter the cell. Instead of those fat droplets, these viral vectors actually have an inactivated virus that kind of allows the coding material to enter into the cells. And once that happens, it's very similar to mRNA, where the spike protein is produced by our own body, and then the immunity occurs. And then just like the mRNA, then in the kind of the material to allow the spike protein to be produced is then rapidly degraded by the body.
Does Covaxin work the same way, or is it different?
Covaxin is an old-fashioned vaccine, I would say. It uses a protein of the spike protein, and then it has something that called an adjuvant that allows the body to make even a stronger reaction than just protein. And we've used other vaccines that are similar, an adjuvant vaccine. But the end result is exactly the same. The body sees the protein and then makes an immune response to it. And then that protein is degraded by the body.
Thank you, Dr. Grant. So it seems like no harmful material is being left inside our body by taking these vaccines. It's just triggering the body to make some helpful proteins, helpful antibodies, so we are protected from COVID. Is there any other last few points that either of you would like to mention in terms of vaccines?
One of the things I found here is there was a lot more anxiety around vaccines when they first were being rolled out. But once you see people getting vaccinated and having what you expect after a vaccine, a sore arm, maybe a little bit of chills during the next day, but then the day after that, you wake up and you're immune and you can feel reassured that you're less likely to get infected, especially after that second vaccine. And I think what we see here, what we're seeing in England, what we're seeing in other countries that have had reasonable rates of vaccination is we're starting to open up and get back to normal. So I think that's really we're hugging our mothers and grandmothers and our children and our friends without concern. So I think that is really the end result. Once we get through that initial anxiety, once we see our friends and family get vaccinated, a lot of people's concerns will decrease.
Right. And the point that we made earlier is that, yes, you hear about people who get COVID after being vaccinated, but really it's very, very few and far between. And the vaccines do give you protection from severe disease and from being hospitalized. So really it's what we need for people to take so that they can, live happily, as Dr. Grant said, and do the things that they want to do in their normal lives.
Thank you both, Dr. Grant and Dr. Subramaniam. I'm with you. I know that after I took the vaccine, the second dose, it did hurt my arm. I did get the fevers and chills, but I came home happy that my family is protected. I'm not going to be bringing any germs from the hospital to my family, and I can be there for my family. So I know that that first 24 hours was a little bit challenging, but I was able to work and my family feels safe with the vaccine. So thank you both for sharing your expertise today on vaccines, and take care, everyone.